So just for context, since you're seeing that there's a lot of preparation and X-rays going on, there you see my colleague Alia with a visitor that we have today from the UK. He's also a vet with seals. And with our intern Enrique, they are preparing to take X-rays. So this seal here is Chabashira. It's a seal that had bone infections in one of the hind flippers, so we had to do surgery to amputate him. And today we're taking control. It's the one here in quarantine 4. They're taking X-rays today to check that the surgery went well, that there's no infection left over, and all of that. He also had a little infection in the front flipper, so we will also take X-rays of that to make sure that it's healing properly. We decided to give it a chance to heal with antibiotics and not do surgical treatment on it. So hopefully it's going good. Unfortunately, during the taking of the X-rays, we will have to ask you to leave for a moment. I will tell you when to, because there's radiations. The glass here doesn't protect you from the radiation, so we don't want anyone to be exposed. If you are close to the seal taking X-rays, you have to wear those special aprons. And yeah, that's what they will be doing now. They will also check the surgery wound, make sure that it's healing well. And yeah, if you have any questions. We take nice pictures of them, so then we have a reference on how it's evolving. Depends, there's a very wide range. I think this one, I don't know the weight by heart, but I think last time we checked around 25-ish. This one is very big for being in phase 1. Usually we wait for them to be, we move them when they're smaller, but this one had to go through surgery and all that, so of course it takes a bit longer. Yeah. Weight-wise and health-wise, the seal is perfectly fine, but she had surgery, so she could not swim as long as normal seals, so that's why we have her more under routine control. If the X-rays of today are good, she will hopefully move to phase 2. Yeah. Usually we release them around 25-30 kilos. Okay, now I will please ask you to stand behind this wall. I will call you back when you can come back to see the seals. Maybe what you can do is that you can leave the phone on the window.
Oh that's yeah, good one.
This is shrimp and seal.
I will ask you to stand just behind the wall for a minute while they take X-rays, then you can come back, I promise.
Oké. Ja, ja. Dus als je die dan schuift, dan kun je de borstel.
So the rule is X-rays, right?
yeah.
They are taking X-rays now,
X-rays,
so
yeah.
that's why we try to reorder. But in a second, when they will be done, you can go back. And we're still taking that, so ask them to work here. So I don't want you to get any radiation, but I will let you know when you can come
It's
back.
okay.
Okay, you can come back. Under warranty, so again I will have to ask you to leave again, but for now you can keep watching.
Oh, ik krijg allemaal al reacties.
Ja, precies.
Ja, dat was wel
Gaat ook zo
grappig.
terugkijken.
Ja, mijn Chinees is niet zo goed. Maar
23, ik kan wel een beetje...
is jouw Chinees goed vandaag?
So I didn't have time to introduce, but this was the X-rays of Chabashira. This is her swimming here. So you still see the wound under her eye. But she's swimming really well, and also the wound is healing nicely, but you still have to see if the infection in her front flipper is good enough or should also be she should also get surgery for that.
So now we're going to feed these ones. These ones we still have to do a lot of vet
So
things. So basically both of them have
I'll
been
get
here
to
for
them
21
for a
days,
moment.
which means that they get their second anti-worm injection. So that's an injection
They just
get
had
in the
food.
flipper. The one with the little number on the head, he had a very swollen right front flipper. So we took X-rays of it. We went through outdoor infection. So far, the radiologist didn't see anything. He saw something suspicious, but he wasn't very sure because it really overlapped with the wound he had. So we're retaking them today to make 100% sure that he doesn't have any infection in the front flipper that is affecting the bone. So yeah, that's the reason why we're taking X-rays, and then we'll also do a blood checkup. Yeah. Unfortunately, when they have infections in the front flippers, it's very hard to treat them with antibiotics. If there's a finger or two involved, then that's great, we can amputate. Otherwise, unfortunately, we cannot release them without the front flipper because they cannot balance themselves, they cannot swim good, so it's not compatible with life in the wild, unfortunately. So that's why we're being very conscious, very careful with him, and being 100% sure that he can be rehabilitated.
Deze is echt heel groot.
But yeah.
Mama, deze is echt heel groot. Dit is echt
So there are also going to be X-rays of one of these seals.
With the seal that doesn't need X-ray. It's the seal that doesn't have the little number on the head, let's say. The one outside of the pool. With that seal, they will check some wounds. They will give the injection for the anti-worms. So we do that every time when they come here and they have lungworms. We do it on their first day and then on their 21st day of rehabilitation. So this is the 21st day. Once they're done with that seal, they will let him eat. He's a self-eater, so he doesn't, well, he gets water today. So he will get some water and then they will let him eat in the pool by himself because he's a self-eater. He doesn't need our help. Next seal also gets the injection because they arrived on the same day. And then he will also need taking blood and the X-ray. So yeah, we will see now.
Gaat je gang hoor.
appearances, he came already with a very swollen face. But then turns out that the other pool mate is biting on him sometimes, so that doesn't help with the recovery. So yeah, now we're just checking, making sure that there's nothing too bad. We use our phones a lot to take a lot of pictures of everything we see because we're a lot of people working and changing the treatments of the animals, so we want to make sure that we have a good reference of how things evolve because yeah, maybe tomorrow I am the one that has to check on the seal and I haven't seen the wounds from close, so I need Alia's pictures to know how it was, you know. For the lungworms. Yeah, Alia is explaining to Enrique how to do it. She will do the first one and then Enrique will do the other seals. So you will witness his first injection here at the seal center. But they don't get enough fish for us to be sure that they're fully hydrated, so we give them some extra water. As we increase the amount of fish that they get, then we will remove the water and then they will not need restraining anymore.
Kijk, zijn hoofdje, nee, heb je dat gezien? Op zijn wang.
In seals, we take blood from the back. So in between the vertebrae, they have like a sort of, we call it a pool of blood. It's called sinus in scientific language. Yeah, basically you just stick a needle in between the vertebrae. That sounds awful, but it works very well. And you can't really do any harm to the seals. So that's how we do it. It's very easy, very efficient. Okay, now you're going to take the other X-rays, so I will kindly ask you to stand behind the wall, or you cannot, or you're protected. And yeah, I don't want anyone to get any radiations when it's not necessary. So if you want to come back to the rest of the meeting, I will let you know later.
So we step out now because of the radiation, which is not good for you if you stand close. So I will just show you the other seals. And here, of course, we have Johnny Jackfruit, who is just chilling at the pool. I'll get you an outside look. This is what you call sumis with dogs. Let us go to Johannes. There's Johannes. Let me see. Yeah, the camera is right there. We are working on it to get it working again. But for now, you can see Johannes and Johnny Jackfruit. And I'll go inside now again to maybe see something of the pups again. The lungworm patients. So here we have, of course, Johnny Jackfruit again. A bit more chill now. And look at her. Kuromame. I still need to look up how I should pronounce it. She's watching Johnny Jackfruit. Okay, let's go back to... Well, perfect timing, because our vet Matilde is now calling us back, because the X-ray was done now. So let's see what we can show you. So the radiation, the radiation of the X-rays is quite dangerous to be there, so that's why we left for a moment. Here is Chabashira again. We started this live stream with X-rays of Chabashira. It was very busy in the center, so I couldn't get it all very well on video. But at least you could see something of it. Now you can watch her now. So let's see. So they're separating them now to get the right food to the right seal. So the X-rays are made and they got their food both, I guess. So I'll let you, of course, know what was the result of the X-rays, especially of Chabashira. So they just had an X-ray taken to see if an infection on her front flipper is healing well enough or that she should have another surgery again. So if she doesn't need a surgery, she will go to phase 2 very soon. If she does need a surgery, I think it goes all again. So she has to rehabilitate again and stay in phase 1 before she can swim and do everything to go to phase 2. So it took all a bit longer than normal because our vet intern got explained how to do everything. So that was why it took a bit longer than normal. Here is Jalapeno. You already seen this seal, I guess, in the last live stream. It also has the lungworm infection, just as most seals right now in the center. So So I'll get you again to the other seals in the other intensive cares. I'm trying not to get people on our video because it's very busy in the center right now because of holidays in the Netherlands. But I'm trying, that's why I muted a lot to not get them talking in the background because privacy. So here we have Paquita Salas. We've seen her last week also in a live stream. She's quite tiny. I think she's the smallest right now in the center. And the lights are off already because the feeding is over. But still you can see her well, I think. So it's a good sign that she can swim. She has the pool available for her. I think not the full day, but at least now, and that's a really good thing. Here we have Sparrow and Ariel, and they were Walter White and Camomile before, but they are renamed. And a colleague told me that they are fighting a lot. You wouldn't say so right now because they're just chilling, but I saw them this morning and they were really fighting each other, which is not uncommon because they have been more in the wild for a longer time than the pups that we had in the summer. So they were like 2 or 3 days old, or maybe a week old, so they weren't really adjusted to the wild, but these seals are a bit more, so they are maybe 2 months old when they come in. So they are a bit more feisty and they fight each other off and try to dominate. Jesse Pinkman, that's funny. Yeah, they try to get their territory, actually. They are just staring at me like, what are you talking about? And that's a fair point. So I'll get you for last time to Kuromame. Just because we're here now. And it's fun to watch them. So here we have the fish kitchen again. Still in the same place. Johnny Jackfruit. Kuromame. He's so big. I think last week he was already 22 kilos or something. And you can see it. So let's end this live stream in the quarantines where we began. With Chabashira. I can really recognize her by the big eyes and the wound that's still on her mouth. So I'm just told that the 4K camera is up again. So you can actually, when I end this live stream, which is really soon in a few minutes, you can go there and watch Johannes and Johnny Jackfruit live. So that's cool. So thank you so much for watching this. We didn't announce beforehand that we were going to live stream, but there was some time to do it, and I didn't want to miss the X-rays of Chabashira and just watch her again, and of course all the other seals. So thank you so much, and have a good day. Bye bye.